Hi, everyone. My name is Dr. Antwiler. I am the addiction medicine faculty for our addiction medicine fellowship that is between Eisenhower Health and Hazelden Betty Ford. I did my residency in family medicine, so again at Eisenhower, and went to do my fellowship. Well, I didn't go anywhere, but I stayed at Eisenhower and Hazelden Betty Ford to do my fellowship, and I stayed back as faculty. So I'm really happy to present this lecture to you all. It is about party or club drugs. What are they? What are the risks with it, the complications, and how you all can stay informed about them. So let's get started. So club drugs or party drugs, they're usually used by young adults or the youth, but that doesn't preclude them from being used by our older population as well, especially in this area. And they're called club drugs or party drugs because they're usually used in the situations of like parties, circuit parties, Coachella, raves, and that's where the name comes from. There are 5 main club or party drugs that is kind of known throughout. So there are GHB, Rohypnol, MDMA, also known as ecstasy, ketamine, and methamphetamine. But there are other club drugs that are existent as well. So there's LSD, nitrous oxide, but the top 5 are the ones that are used most commonly. Usually club drugs are a mixture of like sedative hypnotics and stimulants, and that's where you will see their mechanism of action kind of come through play. And there's often this misconception that club or party drugs are safe and they're benign, but that's not true. And they can actually cause a lot of complications that we'll talk about later on. And unfortunately, club or party drugs, they can cause disinhibition and increase sexual arousal. So they can be used in the commission of a sexual assault. So starting off with GHB, name comes from gamma hydroxybutyrate. It goes by liquid G or liquid ecstasy. Again, the usual use of age for GHB is between 18 to 30, but that's not uncommon for older population to use it, and it is pretty prevalent in 50s, 60s, and 70 years old, the population that's kind of in the desert. And around the time between like 1994 to 2002, there was actually a huge rise in the use of GHB. There was actually like a 9,000% increase where people were coming to the emergency room because of GHB use and their intoxication symptoms or from withdrawal symptoms. So GHB actually comes in 3 forms. It comes in a liquid, a white powder, or a pill. The liquid is the most common way to use it. And what's interesting is that GHB actually is endogenous in our body. So GHB are natural neurotransmitters that are kind of floating through our brain and our body. And this is where like outside use of GHB kind of comes into play. So GHB's mechanism is kind of biphasic. So when you're using low amounts of GHB, it actually increases the dopamine release, and that's where you get the stimulatory effects from GHB. However, when you're using GHB at higher concentrations, it acts on our neurotransmitter known as GABA B or GABA butyric acid B receptors, and that's where the sedative effects kind of come into play. So with GHB, the result kind of depends on how much you're using. And the recreational dose of GHB is not really easy to estimate. They say that at 100 milligrams per liters, that's where the euphoria, the happiness, relaxation can come into play. But then doses of up to like 500 milligrams or milligrams per liter can lead to like respiratory depression and problems with breathing. So the symptoms of GHB intoxication, it's variable. It depends on the dose you're taking, the way you're taking it, or each person's individual tolerance to depressants or sedatives. So GHB is pretty fast acting, and the effects can take place within like 15 to 50 minutes. And that's where people who use it might feel less inhibited. Other symptoms could be like relaxation, euphoria, be feeling a little bit confused, and other intoxication symptoms can include like memory loss, having poor reflexes, but some scarier symptoms of intoxication can include like grinding of your teeth, vertigo, weird like movement disorders, weird movements of your eyes, something to kind of be aware of. For the most part, because GHB is kind of short acting, rapid recovery will take place. But unfortunately, the amount you take might not always lead to rapid recovery. At this time, there are no antidotes to reverse the sedative or intoxicating effects of GHB. So when you come to the hospital for like GHB intoxication, it's mainly going to be supportive care. On top of that, if you use GHB often or daily, you can develop dependence to GHB, and that's what can lead to withdrawal symptoms. So mild withdrawal symptoms might be anxiety, agitation, not sleeping properly. This can escalate to having high blood pressure, having tremors, and then you can get very serious withdrawal symptoms like seizures, hallucinations, muscle damage, and that's where you would need to go to the hospital. So again, there is no evidence-based protocol to treat GHB withdrawal, but at this time we give benzos, so Ativan or Valium, to kind of treat that withdrawal symptoms. There are some studies which are evaluating the efficacy of baclofen, which is a muscle relaxant, and some studies are seeing if this medication can help reduce cravings, act as a relapse prevention medication, also help with anxiety. So some providers, like including myself, do use baclofen to help with cravings, but it's still not FDA approved at this time. So coming to our next party drug, Rohypnol. We all have heard of roofies. It is a type of benzodiazepine. It's also known as flunitrazepam, and it's pretty popular because it's very cheap. The youth can easily get a hold of it, and it's often, as you can see on the right side, it's kind of sold in that packaging, so people think it's like an actual prescription drug or it's legal. And like I mentioned earlier, it belongs to the class of medications known as benzos. We've heard of Valium, Ativan, Klonopin. Rohypnol is actually 10 times stronger than Valium. And you might see a common theme here. So GHB and Rohypnol, they affect the neurotransmitter GABA, and that's actually our inhibitory neurotransmitter. So just to give an idea, GABA in our body, what it does is that it kind of slows the ability of neurons to kind of like send messages to each other. So basically it stops the communication between brain cells or neurons. So when someone misuses GHB or Rohypnol, these substances basically enhance the effect of GABA, and it further decreases that communication or linkage between neurons or brain cells. So because of that decreased communication or that depressant effect, that's where the sedative effects come into place, that drowsiness, that confusion, and this could lead to complications such as coma, and if combined with other substances, can lead to like an overdose. So the concern is that with any drug that can cause this like disinhibition, sedation, or increase in arousal or libido, it can be used to facilitate a sexual assault, which is, that's why Rohypnol sometimes is known as the date rape drug. And then when you combine it with other sedatives like alcohol or opioids, and this is where you can lead to having like cardiorespiratory depression or even death. And out of all like the substances, especially out of all the benzos, flunitrazepam or Rohypnol had the highest potential for misusing it. And as I mentioned with GHB, even with the benzo, when it's being used daily for longer than 3 to 4 weeks, you are going to develop a dependence to it. And if you stop suddenly, you're going to have withdrawal symptoms. So when that happens, treatment, if you go to the hospital or even the clinic, you want to first do supportive care. You want to make sure the symptoms are controlled. For example, like high blood pressure, you want to maintain that, hydration, hyperthermia, any muscle damage, or if there's excess of serotonin, leading to serotonin syndrome, you want to take care of that first. At the same time, you want to also help patients to be tapered off the benzo or the Rohypnol, because if you immediately take someone off, they can get seizures or hallucinations, or they might have rebound insomnia and anxiety. So it's very important to see an addiction medicine provider or any provider to be safely tapered off of it. And for Rohypnol, there is an antidote that's available. It's known as flumazenil that can be given in the hospital. However, there are also risks that are associated with flumazenil, like seizures. So just be careful when it comes to using these substances. So coming on to MDA, also known as ecstasy. So we've heard of this. It's used in clubs, raves, also used in like other social settings, maybe like concerts. And MDA is a stimulant. It's a derivative of amphetamine. And MDA or ecstasy can be taken orally, and that's where the slang molecular or molly comes from. And it basically refers to that pure crystalline powder form. And how MDMA works is that it basically is involved in increasing all the neurotransmitters in our brain. So that includes serotonin, dopamine, norepinephrine. So when you take MDMA, if you look at this picture on this right side, what it tries to do is it tries to increase the amount of neurotransmitters, particularly serotonin, in this area. And it prevents the uptake inhibitors, which normally kind of remove them, prevents them from working, so causing more and more amount of serotonin or dopamine to be released. So keeping that in mind, serotonin is really important for our mood, our sleep, pain, emotion, appetite. So when MDMA is used, more serotonin is being released in that specific area. So there's like a excessive amount, and that's what leads to the euphoric effects. However, when there's so much being released, later on, it gets depleted. So that's why after using MDMA after some time, people who use it might feel like depressed, they have sleep issues, anhedonia, and that's because there's a huge depletion after the initial surge that was released. And also important to note that MDMA is an empathogen. So what that means is that it helps release oxytocin and vasopressin. So that's where the feelings of love, trust, and sexual arousal come into play. And these are just kind of the areas that I wanted to show that are affected by MDMA and what those effects kind of correlate to. So again, MDMA is like an empathogen and actogen. It gives that feeling of warmth, empathy. You're able to connect with others. So as you can see here, it affects the frontal cortex, and that's where, people who are using ecstasy might have like heightened perception. It affects the amygdala, and that's where you get the elevated mood. And then by affecting the hypothalamus, it can reduce the appetite. So it directly affects the brain regions. And I'm kind of repeat this because a lot of times people use MDA, they don't think there might be consequences or complications that come from it. So MDMA doesn't just affect the brain cells or the brain, it actually has complications that kind of go throughout the whole body. So to kind of relate that, I have a picture on the right side here. And you can see in that picture, that left side, half of the brain, that's like a normal brain. There's like dark areas, the purple area, which is kind of where the serotonin neurons are kind of in place. And you can see on the right half where the brain kind of looks damaged. That's basically 3 weeks after using MDMA consistently. And you can see that the dark areas or the damaged areas is where serotonin is depleted or serotonin is gone. And again, another picture, this is basically to show the long-term effects that MDA can have on your brain. So this is actually a cross-section of a monkey's brain and the serotonin neurons that are in place. So if you see the first picture to your left, that's a normal brain, normal serotonin neuron fibers. It's thick, it's accumulated, that looks good. But then right 2 weeks after using MDMA, you can see how many sparse areas that there are. Those are all areas where there is basically no serotonin in your brain. And that's where people get depressed, they get moody, they can even get like suicidal. And what's important to kind of see on the picture to the right is that even like 7 years from that use, the brain and the serotonin hasn't fully recovered. You can still see patchy areas of black over here where there's loss of serotonin neurons, and that's worrying about because serotonin is so effective or so essential for mood, appetite, or sexual arousal. So you can see that these effects are long-term. And then to kind of go through all the other complications, MDMA can affect all the way from the heart to the liver. So it puts strain on the heart, so it can lead to heart attacks by increasing the blood pressure and heart rate. It can also cause issues with your thermoregulation, and that's where people can get heat strokes. It can also cause kidney failure. So when people take MDMA, it can cause death of large amounts of muscle tissue, and then muscle tissue can kind of float around in the circulation. And if it blocks or if it enters the kidney, it can lead to kidney damage. And then another important complication is that when people use MDMA, they're dancing for long periods or staying active, they forget to keep themselves hydrated. But what they do is that after finishing that activity, they try to drink a lot of water to make up for dancing so long in the heat. And this actually causes the cells to kind of swell and burst. And this can also cause low sodium. So it's very important that if someone's using MDMA, to kind of keep yourself hydrated during those activities. And then on the liver, MDMA can be toxic. And then again, kind of like in the brain, as I explained with the damage of the serotonin neurons, that huge release of the norepinephrine, the dopamine, that can cause like seizures, and it can also cause serotonin syndrome because of that excessive serotonin release. And that's where people can get confusion, tremors, and different movement disorders in their body. So this is just to show that Molly or ecstasy does have a lot of complications to it. So coming to the treatment of MDMA, it's just a general approach. You want to hydrate, you want to stabilize, make sure they're breathing, give fluids, make sure their circulation's going good. And then if there's signs of like agitation, anxiety, tremors, again, the treatment is with benzos. So benzos such as Valium or Ativan or Librium. So that's kind of a common theme with club or party drugs. And at this time, there is no pharmacological treatment for cravings for MDMA. The most effective treatments are psychosocial. So that's where CBT comes in, increasing coping skills or support groups like NA meetings. And just a side note, for a couple of years, FDA was kind of trying to do studies on MDMA to see if it could be used for the treatment of PTSD. But a few months earlier, because of the side effects and the safety concerns, the FDA decided not to approve MDMA or MAPS therapy for PTSD. So coming to ketamine, ketamine is also known as Special K. So it's usually a white powder. It can be added to drinks. It can be smoked. It can be snorted. It has no specific like smell or taste to it. So it's really hard to detect. And it's at high doses where people can get that feeling known as the K-hole, in which they feel like their whole body has shut down. And ketamine works on a different receptor. So it works on a receptor known as the NMDA receptor, and NMDA and glutamate receptors are very involved with the way our brain cells or neurons interact, communicates. It's associated with learning. It's involved in this process known as neuroplasticity. So when you use ketamine or misuse it, it can cause problems with learning, memory, awareness, and judgment. And as with all club or party drugs, ketamine also disrupts the action of dopamine by increasing it. So ketamine's effects, so it has physical effects and it has psychological effects. So at low doses, people would say that they get this spiritual-like experience, this transcendental kind of feeling. They're like, it's like a dream-like euphoric state. They're floating. And then at higher doses, they can have vomiting. They can even have seizures. They can have kidney issues. Memory can be affected for a few days. And then the psychological effects are basically that, again, it kind of goes to that spiritual experience, but people can have a near death or out of body experience, delirium, they can hallucinate, and it can lead to depression. On a side note, you all might have heard of the One Direction member, Liam Payne's death, and he had been using pink cocaine. So I just kind of wanted to bring that to your all's attention. It's known as Tussie, and it's a combination of ketamine plus cocaine or ketamine plus MDMA. So there are complications that can arise from it. And again, the management is, if it's intoxication and withdrawal, it's pretty short-lived. It doesn't really have long-lasting effects, but if it becomes more aggressive, if there's more agitation, seizures, then again, benzos, so Valium, Librium, Ativan are the mainstay for treatment. So coming on to methamphetamine, I'm not going to go too much into detail about methamphetamine, but we know it's a CNS stimulant, very addictive. For the most part, it can be smoked or it can be slammed or injected. And the reason people sometimes prefer methamphetamine over cocaine is that it lasts longer in the body. It has a longer half-life. And just to kind of talk about the complications that come with meth use and to kind of just actually see the complications. So on our left side, we have an MRI image basically of our brain. And you can see on the left side, these red areas, and this is of a normal brain. That's where the transporters that basically take care of dopamine are. And you can see it's nice and dark and red. However, in a person who's using meth, and you can see here, there's not much red. And that basically indicates that because so much dopamine was taken out and used and misused, their transporters are very low. So that's why they're often depressed. There can be long-term anhedonia, no desire to doing things. And that's because of this problems with the dopamine and the dopamine transporter. And then again, you can see here on the picture to the right, again, the normal brain, you can see the red like images in the middle, that's normal. And then you see the brain image from someone who has actually stopped using meth after a month. And you can see there's like no improvement in the middle. There's no red spots there. And then even after like 14 months abstinence, it's still not completely back to normal, but obviously there is improvement. So I think that's important to show that, especially for people who are in early sobriety from stimulants and meth use, to kind of reassure them that the depression, the feelings of irritability, the anger, the mood, it will dissipate with time, but it can be expected, as you can see, because of the loss of the dopamine transporters. So methamphetamine has complications throughout the body. So starting with the brain, there's delirium, there can be seizures, there's release of norepinephrine. It can cause brain bleeds, strokes. And then in terms of psych components, anxiety, depression, that increased release of dopamine can cause like schizophrenia-like symptoms. And then you probably, if you haven't seen people's mouth, there's a term meth mouth, there's poor oral hygiene, there's dental decay going on. And then again, with the cardiovascular system, because of that release of norepinephrine, epinephrine, it can lead to heart attacks, and can lead to break in the big arteries, and it can lead to cardiomyopathy. And then again, similar mechanism for the GI system, that poor perfusion in the colon can cause problems there, poor perfusion in the kidneys, poor perfusion in the muscles, and then lastly in the skin, if there's any kind of IV or IM use, there's going to be abscesses or skin infections. So with methamphetamine, the complications are just numerous. So this is just a side note to kind of bring, because a lot of people where we live are struggling with HIV, or they're involved in some form of long-term survivor. So I wanted to kind of correlate the club drug use and HIV. So when it comes to methamphetamine and MDA, they've been shown to affect or influence the cellular immune responses in the body. For example, methamphetamine increases cytokine levels, and we've heard of like different cytokines that are involved with different diseases. So that basically means that the body's extra aware to see if there's an inflammatory response going on. And this could be a little bit concerning in patients who have chronic HIV disease. We don't want any kind of unnecessary or negative immune activation going on. And then with methamphetamine use, the studies found that people who used it in the setting of HIV, they had higher viral loads, and their antiretroviral therapy was not as effective. And also, because of the club drug binging and maybe being disinhibited and not being maybe in the right mind frame, there could be decreased adherence to the antiretroviral treatment during these binging or these episodic club drug use. And that's where it gets a little concerning, because if someone's not being adherent to their antiretroviral treatment, then that's going to develop into drug-resistant HIV, which can become a treatment failure. And another note is that using club drugs with antiretroviral treatments, they might have drug-to-drug interactions, and some of them might be even fatal. So for example, MDMA, GHB, ketamine, and methamphetamine, they're all kind of cleared through the same enzyme system as are a variety of HIV medications. So this could lead to delayed clearance of the medications, or it could even lead to increase in the blood levels, which can cause side effects. So this is just important to be aware of the usage of club drugs or party drugs in the setting of HIV. And this, I just wanted to highlight one of the club drug deaths. People usually associate substance use deaths to opioids. So I just wanted to make sure the same amount of importance is kind of given to club drugs as well. So this was Morgan Jones. He was 19 years old, basically tried ecstasy. tried the drug, basically tried it twice, and he basically died from some of the complications of ecstasy. So the story is just to kind of highlight that you really don't know what your own limit is to die or have complications from it. So this is just to show to be careful with party drugs. And then lastly, I'm just kind of ending it off with this, just, be sure to party smart. So things to kind of keep in mind is keep yourself hydrated. Don't overhydrate yourself because it could lead to electrolyte disturbances. Try not to mix the club drugs with alcohol or opioids, because when two sedatives are kind of like added together, it can increase the risk of an overdose or respiratory depression or cardiac depression. Be mindful that risky behavior, sexually transmitted infections can be associated with club drug use. And also because of the lowering of your inhibition and sexual arousal, it can be used in the commission of a sexual assault. And please refer anyone you know that might be struggling with a club drug use disorder. Behavioral health and addiction medicine are great resources to help with the therapy aspect of it, or to see if there might be any benzos that might be needed for withdrawals. So please use us as a valuable resource. And then I've put some websites for you all to look into if you're interested in wanting to find out more information.
All right. Thank you all very much, and have a safe evening.
Have a good night, everyone.